I'm sorry, say that again, Josh.
I was hoping while you're working on that, you could sing us a song, something.
No, trust me, you don't really want that at all. You don't want that at all. But again, welcome. Thanks to everyone who joined us today, and we are being recorded. And as this is not our normal housing navigation / case management kind of meeting, we won't be discussing clients as individuals who don't have confidentiality agreements, and thus we won't discuss clients during this meeting. But this is more of a general overview of what's been going on, what's to come, and some really cool announcements. Start off by apologizing on behalf of Pam from the community. From Consolidated Government, Deputy City Manager Pam Hodge. She got a invite late yesterday afternoon. In fact, she was told that she had a budget review session that was going to take place this afternoon at 2:00. So obviously that takes precedence, and so she was going to have to attend that rather than be with us today. She did share some information with me that she expressed that I will share with the group to talk about what's come. And Denise, I don't know if you want to jump in at any point during this to clarify or help field a question, or if we want how that we'll go through that. But we'll just take it as it comes and see how we go here. So again, Pam was to talk first, and then we're going to talk about some program flexibility that we're going to have regarding coordinated entry as it applies to the pandemic, the reaction, the response. Also, as we go through this and we are learning more things about each other and the capabilities that we have or the limitations that we may or may not have. Miss Addie Britt from the Census, from the Columbus Consolidated Government, representing the city's efforts for the 2020 census, is going to talk to us about some real new information she has about service-based enumeration and how we as homeless service providers, HMIS users, and those kinds of things may be able to assist. We're going to talk a little bit about some mega waiver information, get an agency update if anybody has one. Looking to the side because there's a car that keeps pulling up and stopping in front of my house. I apologize. Agency updates, a wrap up on where we are, where we're going, announcements, and then the links to all of the information that's contained here, and then just some other things that we've got that may be useful to one or more of us. Thank you for that slide there, Terry, on Columbus and We Do Amazing. But just to quickly just show you the CDBG funding eligible activities are going to be available through some funding that the city.
Let me jump on this thing.
Hey, Melvin, can you mute your phone, please? We're CDBG funds that are going to be available as a result of COVID or in response to COVID are obviously come through the Columbus Consolidated Government. These are some of the activities, and this is going to be available afterwards, so don't feel necessary to sit there and try and read it all. It's about providing public assistance, technical. Some of it's about construction and those kinds of things. There are areas that are available for small businesses, and I clearly clarified with Pam yesterday afternoon, as it is not listed as a specific line item in this quick guide. Rental and or housing assistance is an eligible activity. That's really important to note. If one of the preliminary discussions have been that there will be that the funding that's available to Columbus, and thank you, Terry, for putting it in here. And I'm pointing to the screen to see me do that. We have $981,000, so nearly $1 million that will be coming to Columbus. It is not here yet. We don't know exactly when that will be available. We all know, as with any of our state or federal grants, they tell you that the money is going to be available, but the actual here doesn't come as quickly as we would like, but we will have close to $1 million available for our community. And as Pam has initially said, they're anticipating it being available in 3 pots, one being for public assistance or public service, one of it being for small business type of activities and grants or loans to shore up some small businesses in our community, and the other third of that pot being for housing assistance, primarily for prevention and diversion. So trying to make sure that we don't create more homeless individuals in our community by shoring up some of the programs who provide number one, rental and mortgage assistance now, or those who wish to do so but have never had the funding capabilities to do so. There will be an application process. Pam assured me yesterday that they're trying to work out the final details of what that application process looks like. All indications are it's not going to be a lengthy, drawn-out application or process. And again, Denise, if you have anything at any point you want to add, please chime in. But probably very similar to the coronavirus relief fund that's going through United Way and the Community Foundation. Though the agencies have been all talking back and forth to try and get the money and the availability out there as quickly as it comes to agencies to use this with the least amount of disruption and extra effort on the part of the agencies. I'm gonna stop right there for just a second to see if anybody has any questions before I keep moving.
Pat, this is Denise.
Yes.
You are correct in stating that as far as doing the application process. We're doing that right now. We're getting it together, seeing what kind of information we need to get from individuals and organizations in the community. But it's going to be similar to the one that the Community Foundation and United Way put out there. It's not going to be extremely detailed application. So if that'll make anything a lot easier for us, it's going to be fairly easy.
Great. Well, thank you for reiterating that, Denise. I appreciate it.
Yes. Okay.
So before we move on to Addie with the census and that kind of thing, I wanted to talk really quickly about with the CDBG funds and some of the flexibilities that are going to be available regarding income limits and those kinds of things. We're well aware, that it's going to change who can be served and those kinds of things. We're looking at, do we need to make some adjustments to coordinated entry to allow people to have direct referrals to programs? How can coordinated entry back up programs in vetting clients, gathering information and all, because everybody is going to be doing much more, unfortunately, in the coming months than we did in the same time last year. And so how can coordinated entry serve as a conduit for the clients, many of whom will be probably entering the assistance or homeless service providers and or community service providers for the first time, and how do we make those referrals as easy as possible, and also for the agencies to make it as easy as possible. So looking at flexibilities, if as those processes become more apparent and the rules on which and how the money can be used, the coordinated entry committee is poised to make any changes we need to, but it's appreciated right now, according to the HUD guidance, that we would not have to amend our coordinated policy and procedure. It could be a short-term amendment in time of disaster. So there's more to come on that, but just wanted to let you know that those are some of the things that are being looked at. Anything on that before we turn it over to you, Addie? All right, Addie, if you'll unmute yourself, I'll go ahead and advance your slides when you're ready.
Thanks, Pat. Appreciate it. And hey, everyone. Hope everyone's doing well. So I just want to give you all just a quick update on the service-based enumeration process, 2020 census. So we can move on to the next slide. So basically, again, that's an old slide just showing the current 2020 census operational adjustments due to COVID-19. And we can also move on to the next slide as well. So the Census Bureau recently on their website updated the service-based enumeration process. So at the
Hey,
moment,
Addie,
yes.
if you will, before we go any further, could you just define what a service-based enumeration is? Just for if there's anyone who hasn't heard of it before?
Yeah, sure. I'm sorry about that. So the service-based enumeration is very similar to a group quarters enumeration, except it's focused on providers that assist individuals with homelessness to try and get a complete count of homeless populations in the region. So basically what happens or what occurs during that count, there's two options. You have enumerators who come in. One way that the count can be done or conducted is through paper response, which enumerators work with providers, our service-based providers, to look at data that they've collected over the days for that enumeration process. And that's how they fill out the forms to get an accurate and complete count for that population, or enumerators will go out very similar with the electronic forms and actually assist those who are homeless with filling out the application in person. So that's basically traditionally what the service-based enumeration process looks like. Again, this year it's a little different due to the pandemic, since field operations for the Census Bureau have been postponed until June 1st. The service-based enumeration process has been postponed indefinitely. So right now, if you look at the Census Bureau website, and I'll add this link to the chat, you'll see under service-based enumeration that they don't have a proposed date for when they're going to start that up yet, because they're still talking with stakeholders within different communities to see what the best move is for that. So currently, even though it was originally postponed until April 29th through May 1st, we currently don't have a date yet for when this process is going to take place. So we can move on to the next slide. So again, the Census Bureau really has just been pushing for everyone in general to take the steps to take the census on their own, so self-response. If you saw the previous slide, one way is going to www.my2020census.gov if you have internet access. And you can also call the year 2020 census by phone. There's up to 13 different languages. And I put down English and Spanish because those are primary languages that we've noticed in the Columbus area. But if there are other languages that you all know that your patrons or clients use, let me know and I'll try to get that number to you if you're interested in having that information. So again, really what we're trying to do from the cities right now is just make sure that organizations that want to pass or spread the word about the 2020 census has the information to be able to share with others. Two, just trying to, again, spread that word as many means as possible, not only through the city, but also through other organizations, social media accounts or other events that they might be doing in order to try to, keep up public participation or, just inform others about what's going on with the organizations during this time. And then also, again, really working with COC providers to make sure everyone's informed of what the service-based enumeration process is and how to possibly prepare, since it is going to be a little different this year. There may be extra constraints, particularly for providers during this time. So we can move on to the next slide. So again, like I said earlier, it's been postponed due to field operations being postponed to June 1st, 2020. We're really trying to keep up with what's going on, and once we hear any news about official date being set, we'll let you all know. So we just wanted to get an idea. I know we touched on this last time I spoke with you all, but we just wanted to know or get an idea of if you all were able to share information about the 2020 census with individuals that use your services, and if there were any ways that you wanted to incorporate that message out, or if you all had any other ideas. We're really open to anything, and we really want to assist your organizations while also not putting an extra burden of, another operation going on when things are, kind of up in the air right now. So whatever providers are comfortable with in assisting with spreading that message, we would love to assist you in doing that. So does anyone have any ideas or any interest in possibly us, providing flyers or, different things like that?
Hi, this is Katie Byers from St. Anne Community Outreach. We're giving groceries out to sometimes 130 families in a day. We would love to have flyers, and we would be glad to put them in the groceries.
Okay, that's awesome. And I will take a note of that. And
But we need a lot.
and we can provide those prints for you. So that's something we're able to do.
So our give out days are Tuesday, Thursdays, but we have someone here at our facility Monday through Thursday in the morning. You can drop anything off.
Okay.
It helps if you let me know you're coming so that we make sure you don't get a locked door.
Right. By any chance, can we switch contact information at the end, or, if Pat, you can help me out with that?
Yeah, I can just give you my email real quick. It's outreach@saspHS.net.
Okay, so I heard outreach at. Can you repeat the end?
SAS stands for St. Anne School, PHS, Pacelli High School.net.
Okay, thank you so much.
You're welcome.
So, and again, if anyone has interest in things like flyers, or if you guys have any ideas that you want assistance with putting in place, just let me know. I'll share my email again at the end. So, if anyone wants to contact me, please feel free anytime. So, if anyone else wants to speak or doesn't want to speak, I'll just move on to the next slide. Okay, so the next portion of this, as far as the SBE process, how I mentioned earlier, there's really two ways that it was conducted in previous years. Either, doing the in-person interview with the enumerator, or the enumerator working with providers to access information of who utilized services during the SBE count. So I'm going to let maybe Pat chime in about what resources the COC providers have access to during that process.
When looking at the handout or the information, the tool for the enumerators, it's very similar to the information we gather on HMIS intakes, on program intakes, coordinated entry intakes, and those kinds of things. So a lot of that information is already being captured. And so possibly thinking of how we can assist providers in with that, in getting it submitted on your SVE or whatever. And that's definitely a discussion I think that is worthy of having, and making it as seamless and as easy as possible. All of this is very similar to information that we gather for our pit count every year. So trying to employ some of those same strategies for that without having to have yet one more thing of one more entity coming and taking up time of different service providers. And for this, it would be, of course, the emergency shelters, transitional shelters, those as they describe it in the information from the Census Bureau, soup kitchens, meal providers, those kinds of things, where people come up on a regular basis and interact and receive on-site services. So really would like to have some discussion on how we make that easy. How do we make sure we capture everyone? Of course, having a true count, making sure we don't have duplicates. And there would be some having to do some cross-referencing of that information. But information, we have it. We're steadily looking at and trying to refine and make sure it's all accurate and clean. But we have a lot of the data that they're needing. So rather than recreate the wheel, trying to assist in pulling that data and getting it to the proper entities so that everyone can be counted and our community can be well represented.
Thanks, Pat. And that's really important. Again, I know there's a lot going on, so we just want to assist and, be ahead of the curve as much as we can to make sure that, once the SBE process begins again, people aren't overwhelmed or, don't have the information that's needed in order to, assist with that operation. And also, again, since we are trying to practice social distancing during this time, again, just if there are any ways that your organization, if you have a capacity or, interest, again, trying to inform your patrons or individuals using your services about how to take the census before the SBE process, if they have the means to do so. So, again, we just want to hear from you all about if you all have ideas on how you all might be able to incorporate trying to get people to take the census before the SBE process if possible, particularly with social distancing, in place. So if you guys have any ideas, please feel free to let me know either now or later on.
And one of the things I think, and I'll just throw this out there, maybe it'll get some discussion going. When we were talking about doing the census back when we started these discussions back last August, and then later in the fall and in the winter, talking about having the bookmobile was going to go to different locations, and there was going to be tablets available and internet access and Wi-Fi access and everything else. Well, that's obviously not going to happen, number one now. Number two, having multiple people touch devices and those kinds of things. And then frankly, a lot of the funding to be able to access additional tablets and those kinds of things have probably been transferred or being used for some other relief response kinds of things right now. So something simple as, what if there were paper census forms at locations with a designated pickup or drop-off date and time, so that we can make sure that they were available should someone need them. Having it to where, it's the papers sit for a set number of days to make sure that, or those who handle it have gloves, wear a mask, all of those kinds of some things. Just thinking about making sure that we capture everybody who is in our community who needs to be counted as part of our census. So that was just one of the ideas. Of course, it was, well, we could put, if we had access to a tablet or some tablets, putting them in Ziploc bags, wiping them down when someone's finished using them. Those are some other ideas. So any type of idea is not too crazy or not too basic. If we live in the internet age, but we may be going back to paper and pen to fill this out for a while. I don't know, but trying to make sure we have a conversation about it. No one?
Well, that's fine. If anyone has any ideas, later on, again, I'll share my email. You guys can send me an email or something like that. But we can move on for now. Okay. So again, I mean, I feel like I'm repeating myself a lot, but just things we want, everyone to kind of keep in mind, or rather to let us know about, is, for planning for the SBE process, if you are concerned about capacity as far as, staff that you have available that may or may not be able to assist with these operations, please let us know. Again, we really want to work with everyone, and we don't want to leave anyone out, even if, let's say you're staff of one or two. Again, I'm not as familiar, so, please, if you're interested, and if you're interested in assisting in the SBE process, or know that you have patrons who need to get counted, please let us know, because again, I would really be more than happy to try and assist you all with being able to facilitate those operations. And we can move on to the next slide.
That was your last.
Never mind then. Thank you, guys.
Any questions, comments, or concerns for Addie? And in fact, Addie, I just wrote down a little note to myself. Perhaps we send out a questionnaire to everyone just to ask what the capacity is, and how assistance might be provided with a couple of check boxes or something. So we'll look at doing that maybe in the very near future.
Sounds like a plan to me.
All right, just going to go over just a couple of things on the mega waiver, as COVID response and funding availabilities. By no means all the information, because literally we all know it changes day to day. Everybody who gets all those emails from me knows it changes day to day. HUD, ESG are putting out updates, it seems like every day, and then they say, oh, there's more to come, so be ready. So we're not an ESG entitlement, but there will be funds, we've been told, that are going to be available through DCA for the Columbus area through ESG. But there's just a couple of things wanted to make sure that everyone sees. Again, you can see at the top there, this is not official guidance from HUD because they haven't given any. Even as late as most recently as late last week, was talking with our HUD TA rep, our HUD field office rep, Barry, and HUD still has not put out official guidance on documentation and how to keep documentation if you have requested a waiver for any of your programs, be they ESG or COC funded. So we asked our HUD TA rep to provide a template or something that maybe other communities were using. And this was developed by HUD TA providers, and is being looked at by HUD for possible inclusion, or they just leave it where as long as you've documented. So just giving programs some type of guideline on documentation, and answering just some questions about if you've applied for a waiver, do I wait to hear back? Can I immediately start using that waiver? Those kinds of things are answered here, as you can see under the required notification. If you 2 days after you requested the waiver, then you are free to act on that. They did clarify that it's 2 business days. So if you did it on Friday evening, you don't start on Monday. It needs to be 2 business days. So
Pat?
Don, yes.
Excuse me, I'm sorry to interrupt. This is Mary Mayrose with the Phoenix City Housing Authority.
Hi.
I just wanted to mention that we were given waivers via a PIH notice dated April 10th, and we have been directed by HUD to not worry about providing any sort of documentation that we have accepted those waivers. But because I'm a former HUD person, I went ahead and had our Board of Commissioners pass a resolution accepting the waivers. And that's how we've documented it.
Okay. Well, thank you for that, Mary. I appreciate that. But talking, and you're right, document that you've documented, that you've got a copy of a copy, just to make sure that we've all covered our proverbial program anatomies. But talking about what you need to have as far as documentation, or some suggestions on what you keep in the file. And again, very, very important that at this time we think of file as not necessarily a folder in a locked filing cabinet. All of these things can be digital as long as they can be saved in a way in which they can be retrieved if you have a review or that information is requested. So making sure that we always note that you have the ability to do electronic documentation, be it in your system, but making sure that it is tied to the client, and doing it in your system and in HMIS probably is the easiest way to do it. So making sure, and just, I'm not going to go through this, talking about inspections as well. These can be virtual inspections, making sure that they're date and time stamped is very important when you're saving them. And some, you can do that in any number of ways through your device, having a newspaper or some kind of documentation, even doing it, having a screenshot of your computer with your date and time on there. So just want to remind everyone that if we'll have this as part of our resources from today's webinar, but that the documentation is just important that you do it the same way for everybody, just to be on the safe side. And again, some things about the consolidated plan that applies to CDBG, some unique things for ESG, and then of course some unique things for HOPWA and that population that they serve. So at this time, I'm going to pause it for just a minute and ask if there's any questions or anything like that on any of that. There's going to be a link. I'm sorry, I forgot to mention, there's going to be a link at the end for a resource. It was the April the 17th HUD office hours. It was probably the best one that I've seen done yet on how, on the breakdown of what's available through, be it from COC, ESG, and CDBG, and some real just bullet points of how you need to do some things, what the flexibilities you have, how to use those flexibilities, and if you the link will take you to the HUD Exchange, where you can not only look at the slides, but I really, really recommend that you listen to the audio of the presentation, because it's really important that we hear the directors, Norm and all those from HUD saying, we have these flexibilities at this time. Please use them to make sure that we house as many individuals and help them to access the services that they so desperately need now going forward. And if you have a waiver and you've taken advantage of those waivers, and you use a self-certification for disability or whatever, they break it down in that April 17th webinar very well, that as long as you have that documentation, again, it can be a digital documentation, it could be the client takes a picture of a statement they've written and they send it to you, and then you save that as part of their electronic file. That certification serves for the life of the enrollment of that program. So it doesn't mean when the waiver expires in 6 months or whatever that you then have to scramble. Now, obviously, if there's documentation that can be had for any of your clients, be it under the waiver or not, please, absolutely, at some point, try to obtain that. But knowing that some things are not going to be able to be done, HUD has given that flexibility. So listening to that recording of that April 17th webinar is invaluable. If anyone was going to listen to any one of them, it would be that one. And so I'm going to hush for a minute and see if there's any questions or concerns. Again, thank you, Mary, for talking about how you guys have verified your waiver documentation. Excuse me. Quietest this group's ever been. Okay, so, sorry, I hit slide too quickly. Agency updates. Anyone that feels the need to, wants to share, talk about where you are, what you're doing, changes, concerns, needs you have, how someone else can help you. We're going to open it up to please share, whether you be a shelter or a service provider or whatever, city government, whomever. Please share anything that at this time that you think that the community at large and especially those who serve our population needs to know. Now I know there's somebody that's got something they need to share. Uh-oh. I hit my button. I apologize. Katie, since you spoke up earlier, I'm going to ask you, you said that you guys are handing handing out, doing food distribution on Tuesdays and Thursdays. What are the times for those? Is Katie muted by chance? I'm going to stop sharing for just a minute so I can see everyone.
Hey, Pat, this is Louis.
Yes. Hey, Mr.
9
Louis.
o'clock, 9 a.m.
9 a.m. on Tuesdays and Thursdays?
On Tuesdays and Thursdays. And they drive up, excuse me?
I was gonna say, do they have to be a Georgia resident?
Are you
No,
talking
all they
about?
have to do is come. We've waived most everything. Katie's really got a great crew out there doing that.
Okay,
And sometimes there'll be many cars lined up at 9.
I'm muted.
There you go, Katie.
We can hear you now.
Okay, all right, I was muted. Actually, they have to be a Muskogee County resident to receive groceries.
Oh, okay.
Okay, but we do, if they show up in the line and they're Alabama, we will give them one time. But because it's USDA groceries, they have to be. And we have referrals. We know over in Russell County, we've got St. Patrick's is doing groceries. We give them a slip with a couple names on it, but we will help them once. We don't turn them away empty-handed. But really, the food's from Muskogee County. And the other caveat is they can only have it once a month. And so we give a larger amount. We're given 10 days, but that's been tough because in a lot of these families, it's really not enough. Our policy is if they show up, we don't keep track unless they come twice. They just can't come a third time, but really they're only supposed to come once.
Thank you. Any other provider have any kind of updates on what's going on at your location?
Neil, did you want to share our plans for reopening Safe House?
No, he says.
Okay, all right, thanks.
Hey, Pat, this is Melinda. I have a question
Hey,
for
Melinda.
Katie.
Yes.
I have a question for Katie. Katie, you mentioned that there are 2 places in Alabama that give away food St. Patrick's. And what's the other place?
Hold on. I have to get the slip.
At the Central Activity Center on the 3rd Saturday of the month.
Okay, so that's once a month for that. And how often does St. Patrick's give out?
It's an as-needed basis. They just have to call. But really recommend also the 211 will have the update on the bigger distributions too.
Okay.
But I'm sorry I'm
Go ahead.
in and out because we're serving back open today. But we do have a couple other things we're helping with. We do still have some utility funds for coronavirus related issues. We have about $500 left of that. We're also we got some money for medication assistance, prescription assistance. So if you have clients that need help with prescriptions, we can do that. And then we're still doing the work clothes and work boots. Clients have to call we're going to start manning our phones starting tomorrow, Monday through Thursday mornings from 9 to 11. So if people need assistance, they can call. We'll get the information and call them back and see what we can do. So if they need certain clothes for work, work boots as we start to open up again, we're trying to be available to provide some of that.
Thank you, Katie. Any other updates at this time? If I can ask really quickly, as you guys are starting to possibly start to phase in your reopening and those kinds of things, making sure that everyone's aware of what the hours are going to be, what the restrictions are going to be, any kind of prerequisites for the clients or anyone coming into your building and those kinds of things. And I know it's an evolving process, and we're all going to try something and then probably reinvent and revise it as we need to. But I'll make sure that we resend the information that came from Candace from 211. I think she sent out and asked for updates about a week ago from programs. We'll make sure that gets sent out in the next day or two as well, just to make sure that everybody is getting the information and being able to share that information. And Lauren will help us in making sure that when we send out the information from today's call and the link to the website, that there's also the link to that resources page where everyone can see the most up-to-date information as well. So let me have to go back to my agenda here because I don't remember what was on it. So if you'll hang on one second. Here we go. So what do we do next? Who needs help, and how can we help each other? And I think we just talked about some of that, but anyone has any needs that that they can get some help from somebody else, please don't hesitate to express those. I know many of us are on the community call every weekday morning at 10 o'clock. It's a great place to discuss those kinds of things, but also, we may be more comfortable in just reaching out to each other's as individuals and or, as program service or community service providers one-on-one or as a group. So please, if you have a need, have a concern, have an issue that hasn't been resolved, please don't hesitate to ask, for some help. And next month's meeting, we are tentatively set to do it virtually again. We don't anticipate that we will be having meetings of more than 5 people for a while. We're tentatively looking at how we're going to phase back in, what date that's going to be, and those kinds of things. But we will definitely be letting everyone know. But we will be doing virtual meetings for at least the foreseeable future. So next month's meeting will be a Tuesday at 2. Maybe a similar format to this. We may pare it down just a little bit. We will see as time goes and as things happen, as announcements come out. I don't know if I mentioned this earlier. The office hours last Friday from HUD said the specifics on ESG program availability of funds and what the eligible costs or eligible activities are. They were supposed to be in a few days, and that was as of Friday. I have not seen anything yet. If someone here has, please share that. But just for anyone who currently has ESG funds or is going to be applying for them in funds that are going to be available through a Department of Community Affairs, those are supposed to be coming out in the near future. So as soon as we have that, we will, of course, share it. I think there was an announcement that came out earlier today. I know we've shared it on our Facebook. Liz sent over about a free bread, pastry, cakes, and desserts giveaway, I think on Friday. We'll also link that here as well. I hope I said that right, Liz. Any other announcements? Anyone know of anything else going on that the room needs to be aware of? Okay. Seeing nothing, there are some resources that excuse me, that we alluded to here, and some things that were just going to be interesting. The link to the office hours I was talking about from HUD for April the 17th is here. Some case studies, some information from how other communities, for instance, in this one, I'm looking at San Francisco, has dealt with the pandemic. Just information that Addie presented on the census and those contacts. Talking about, we also have some other things about how to get some questions answered, resources, and training and program support for all of us as we go forward in this. And then some of the flyers from Addie, and talking about how to help clients get their impact payments. So again, these will all be available. Any other things before we wrap it up? I'm gonna give it about a minute before we close it out. Does anyone have anything they need to share, suggest, need to get off the chest, want to celebrate? You know, somebody had a birth, a wedding, an engagement, anything, any birthday?
I have a quick question. Is there anybody that has prevention funding right now?
Oh, okay. So you're asking, does someone have prevention funding? I know that there are several agencies that were funded, excuse me, out of the coronavirus relief fund for prevention, and I don't want to point anyone or direct ask anyone in particular, but if there's anyone here that still has prevention funds, I'm sorry, I'm losing my screens here. There are prevention funds but we can certainly ask. Ask around. Do you have a particular need? Okay, Melvin Morgan, Volunteers of America has them for veterans. Is there anyone else? I can't see the chat box for some reason. I'm sure it's a user thing here. Now,
I was just asking. I have a landlord that had contacted me, and he has several of his tenants that are out of work right now, and they're struggling. And he was contacting me to see if there was anything available for them, because he said they're really good tenants. He wants to keep them, and so I just thought it would be something I could ask to see.
Right. And again, I don't want to put any particular program on the spot, but I know there have been some prevention funds given out as part of the coronavirus relief fund. Okay. Again, Volunteers of America says in the chat here that they're more than willing to help if they're veterans. So if anybody else has prevention funds, they're going to be prevention funds as part of the CDBG funding. But again, we don't know how soon that can be or how soon that will be available. So we can certainly do a little bit of research on your behalf there, Chris.
Okay, thank you.
Anything else before we wrap this up, folks?
Yeah, if I can't see your name, or if you can't see your name, I don't know if you're here. I mean, so you get credit. Please let me know who's here.
Do we want to go down the list really quick of who's here? Who do you have listed already on your little handy dandy? Terry. Okay, we have Open Door. We have Kim and Crystal from Open Door. We have Louie. We have Katie, Kathy, Desta from Ecovia Solutions, Josh from Salvation Army, Melvin Morgan, Volunteers of America, Neil from Safe House, Pam Jones from New Horizons, Reverend Mike, hey, you doing, buddy, from Salvation Army, Virginia from New Horizons, Vivian from New Horizons. I don't know, I sent this person a message. Someone else is showing up as numbers, but not with a name. Andrea is here. Antoine is here. Denise, Addie is here. We're Kathy Robinson, Cheryl Williams, Debbie Stewart, Liz from Homeless Resource Network. And I'm seeing if I can go over and get more people here. Okay, there was Liz and there's James from Salvation Army, Jennifer Lohman. I have Liz again. So I have Liz on here twice. Melinda is here, Mary Mayrose, Michelle Mullen, Shantae Williams, Tammy Redding, and that's who I have. So if your name was not called, you're showing up as numbers or just as a call-in. So please identify yourself so we can have a record of you being with us today. We can unmute everyone, Lauren, for just a minute. Talking, we can't hear you.
Hey, Pat, can you hear me?
Yes.
This is Nancy. This is Nancy Williams. You've got Nancy Williams and Melanie's Close from Piedmont Columbus Regional.
Nancy and Melanie's. Thank you, guys.
Hi, this is Vanita Beatty from the VA Homeless Program.
Hey there, Ms. Beatty. How are you?
Good.
I'm cold away. He was a guy that he hadn't been back in a little while. He just switched jobs.
Neil, mute yourself, Neil. We just muted you. Any other call-in individuals?
Okay. We tried to talk to me and they act in a group. I'm back.
All right.
I'm for the
Are free.
Pat.
I'm sure we have someone that's missing, but we're going to go ahead and wrap this up. If we didn't call your name and you want to be recorded on the attendance, you'll just shoot us an email, shoot us a text message, whatever. Just make sure that we've recorded you being here today. That would be great. With nothing else, we'll call it a day, and everyone have a wonderful get out and enjoy some of the sunshine this afternoon. Have a great one. Bye-bye.
All right.
2:07.